Imagine walking into a pharmacy only to find the weight loss medication section empty. This is not a one-off incident, but a growing global crisis. The demand for weight loss medications has soared, leaving pharmacies scrambling to keep up, and shelves often barren. But why this surge in demand? The answer can be traced back to the escalating global health issue of obesity. As more and more people grapple with weight-related problems, the quest for quick and effective solutions has intensified. Weight loss medications, promising a seemingly easy fix, have become the go-to for many. However, the demand is one side of the coin. The other is the shortage of these medications, a problem that's not just about ramping up production. The production of weight loss medications is a complex process, relying on a variety of key ingredients. These ingredients are often sourced globally, making the process susceptible to disruptions in international supply chains. Add to this the rigorous regulatory approvals required for these medications, and it becomes clear why the supply can't keep pace with the demand. But there's more. The current health-conscious era we live in has amplified the demand for these medications. People are more aware, more informed about their health, and more willing to take steps to improve it. And this consciousness, coupled with the desire for quick results, has resulted in an unprecedented demand for weight loss medications. This shortage is not a simple matter of supply and demand, but a complex issue with far-reaching implications. It affects not just the individuals seeking to lose weight, but also the healthcare system, the pharmaceutical industry, and the global economy. The weight loss medication crisis is a call to action, urging us to address this issue head-on, to seek sustainable solutions, and to ensure health and wellness for all. This is not just about empty shelves in pharmacies, it's about the health of our global community. And it's a conversation we need to have now more than ever. To shed more light on this crisis, we've brought in experts from the medical and pharmaceutical fields. Dr. Chiadi Ndumele, Director of Obesity and Cardiometabolic Research in the Division of Cardiology at Johns Hopkins Medicine in Baltimore, said this in a presentation earlier this year at an American Heart Association meeting in Chicago. Obesity has been a long-standing clinical and public health change, and it's growing in scope, he says. The findings have not yet been published in a peer-reviewed journal, but he goes on to say, in recent years we've developed increasingly powerful pharmacotherapies, particularly these GLP-1 receptor agonists, that have a fairly profound impact on obesity, he said, referring to the class of drugs that includes Ozempic, Wegovy, and Zepbound. Next, we hear from American Society of Health System Pharmacists CEO Paul Abramowitz. He explains we all know that managing shortages isn't enough and is not a sustainable solution to the worsening crisis. Abramowitz goes on to say, much work remains to be done at the federal level to fix the root causes of drug shortages. This weight loss shortage isn't just about people not getting their weight loss pills, it's about the impact on their overall health. When patients can't access the medication they need, it can lead to serious health complications. Like CEO Paul Abramowitz mentions, the pharmaceutical industry is working hard to address these challenges. They are ramping up production, adopting innovative manufacturing techniques, and exploring alternative supply routes. But it's not a switch they can flip overnight, unfortunately. It requires time and concerted effort. This crisis highlights the need for a comprehensive approach to tackling obesity. Medication is just one piece of the puzzle. We need to focus on prevention strategies, promoting healthier lifestyles, and making nutritious food more accessible and affordable. While the current situation is dire, it's also a catalyst for innovation. It's driving the development of new drugs and alternative treatments. We're hopeful that these advancements will help alleviate the shortage and provide more effective solutions for weight loss. Harvard T.H. Chan School of Public Health's Walter Willett, professor of epidemiology and nutrition, was among the experts quoted in an October 22 New York Times article about the unknown costs of drugs like Ozempic and Wegovy. You can see this ballooning completely out of control, Willett said in the article, reflecting on the 50% increase the drugs could potentially add to U.S. healthcare spending. As our experts have highlighted, solutions to this crisis require a multifaceted approach. Now let's delve into the influence of social media on the soaring demand for weight loss medications. We live in a digital age where social media has become a significant part of our daily lives. It's no surprise that it has a profound impact on our perceptions, especially when it comes to health and wellness. The role of social media and influencers in the popularity of weight loss drugs is a tale as old as time, or at least as old as the internet. In this day and age, influencers have become the modern-day celebrities. They leverage their large follower bases to promote various products, including weight loss medications. The power of their testimonials, often coupled with dramatic before and after photos, can be compelling. The promise of quick and easy weight loss is enticing, leading to an increased demand for these medications. However, not all that glitters is gold. The downside of this trend is that these influencers seldom share the potential risks and side effects of these medications. The emphasis is often on the results rather than the journey, and this can create unrealistic expectations. It's also important to remember that what works for one person may not necessarily work for another. Furthermore, the promotion of weight loss drugs by influencers can sometimes overshadow healthier, more sustainable weight loss methods, such as regular exercise and a balanced diet. This can lead to a reliance on medications for weight loss, contributing to the soaring demand and subsequent shortage. Additionally, the spread of misinformation and unregulated advice on social media platforms can be potentially harmful. It's crucial to consult healthcare professionals before starting any weight loss regimen, including medications. In conclusion, while social media has played a significant role in boosting the demand for weight loss drugs, it's important to approach this trend with a critical eye. Always remember to do your research and consult a healthcare professional before jumping on the bandwagon. The power of social media is undeniable, but it's crucial to note that quick fixes promoted online may not be the best solution for everyone. Patients who rely on these drugs are feeling the brunt of this shortage. Let's delve into the real-life experiences of these individuals to understand the gravity of the situation. Imagine Jane. She's been on a weight loss regimen for the past 6 months, relying on a specific medication to help control her weight. Suddenly, her pharmacy runs out of stock. She searches nearby pharmacies, but they too are out of her medication. Jane is now forced to pause her treatment, potentially reversing the progress she's made. Then there's Michael, a patient with obesity-related health complications. His medication is not just for weight loss, but a crucial part of managing his overall health. The shortage means he's now facing increased health risks due to uncontrolled weight. And it's not just Jane and Michael. Thousands of individuals across the globe are grappling with the same problem. The inability to access weight loss medications is causing distress, anxiety, and uncertainty. It's disrupting treatment plans and posing a significant risk to the health of those who rely on these drugs. Moreover, the shortage has led to a dramatic increase in prices. With supply unable to meet demand, the cost of available weight loss medications has skyrocketed. People are being forced to pay higher prices, often out of pocket, putting an additional financial strain on them. In some cases, patients are turning to unregulated or less effective alternatives, which can come with their own set of health risks. These alternatives may not have undergone the same rigorous testing or have the proven effectiveness of prescribed weight loss medications. The shortage of weight loss medication is not just an inconvenience, but a serious health concern for many. It's a wake-up call for us to understand the importance of these medications and the critical role they play in the lives of those striving to manage their weight and improve their health. Despite the current crisis, there's hope on the horizon. The weight loss medication shortage, while troubling, is not a permanent state. Potential solutions are already emerging, promising a brighter future for those seeking medical assistance with weight loss. Pharmaceutical companies, recognizing the escalating demand, are taking steps to increase production. Global supply chains are being strengthened and diversified, with efforts underway to ensure that key ingredients for these medications are more readily available. It's a complex process, sure, but one that holds the promise of alleviating the current shortage in the long term. In addition to ramping up production, the medical community is exploring alternative treatments for weight loss. These could range from lifestyle modifications to new therapeutic approaches that don't rely on traditional weight loss medication. The goal is to provide a wider array of options for individuals, making it possible for more people to find a solution that works for them. research and development are also in overdrive, with new drugs in the pipeline. These potential game changers are being designed with the current crisis in mind, aiming to be more efficient to produce, more effective in action, and less dependent on scarce resources. It's an exciting time in the field, with the promise of these innovations bringing us one step closer to resolving the current crisis. But let's not forget, all these solutions require time, patience, and concerted effort from all stakeholders: the pharmaceutical industry, healthcare providers, and indeed, patients themselves. It's a collective effort, one that will require understanding, cooperation, and persistence. The road to resolving the weight loss medication crisis may be challenging, but with concerted efforts, a solution is within reach. As we move forward, let's take these developments as a sign of hope, a testament to our ability to adapt, innovate, and overcome even the most daunting of health crises.